people are eligible to participate to get a bone marrow transplant, the main criteria are really what kind of shape the patient is in. A lot of it depends on what type of disease they have as well. So do they have a disease that we can treat with bone marrow transplant that makes a difference in their survival? And are they otherwise in good shape, meaning their heart, lungs, liver, kidneys are all in good health and can tolerate going through high doses of chemotherapy. It does not mean that some people are too old to get a transplant or too young. Really, it's not the age or the number of years you live, it's how you live those years and what kind of shape your body's in order to go through this intensive therapy. There are many people out there who could benefit from bone marrow transplant, who for different reasons are not referred in for treatment. And the reasons are varied. It could be they don't have access to a doctor to treat their cancer in the first place. They don't have a car, they don't have enough money, they don't have the social support to bring them to their treatments. So that's a very important factor and helping people at least get the word out and other institutions that can help these people in many ways. The other factor that can help is talking to the community physicians, the family practice docs, the internal medicine docs, and even some of the other community oncologists out there to let them know what the indications are for transplant and the ways to get people to transplant centers for evaluation. I think one of the most important things is that if we can at least see those people at the bone marrow transplant centers, then we can evaluate, we can decide if they're eligible for a transplant, and also look to see if we have ways of helping them go through the treatment. There are very important questions patients should ask their own doctor. They should go ahead and ask them to completely explain the cancer and the prognosis and the different treatments. There are often different treatments available for some cancers. When bone marrow transplant's involved, then the patients should talk to a bone marrow transplant physician or specialist to help explain all the nuances of going through high-dose chemotherapy and bone marrow transplant, and what's it like to recover from the chemotherapy, and also what is it like for the patient's family or caregivers to recover from the chemotherapy. If the patient's primary physician or primary oncologist is talking to the patient about bone marrow transplant, they should be referred to talk to a bone marrow transplant specialist about all the nuances of transplant, as well as the latest research and advances we've made in doing bone marrow transplants.